you were getting hospitalized and you were getting surgery, and that was the medical approach to that. At that point, if you had that, they would inject the dye into your spine to see if it's herniated. And if it was herniated while you were still under anesthesia and they were doing the test, they would then do surgery on you.
And when that brain and spinal cord start to have better control and coordination of every aspect of your function, a long list of other symptoms that were just normal to me.
Hi everyone, it's Dr. Silverman here today. And you know, I've been doing a lot of these videos and trying to get people to understand a little bit more about, you know, all the different professions that work with you with your health problems and the limitations, so to speak, that each one has. Because so many times I get into these controversies with MDs who basically say I'm trying to practice medicine, when in reality, nutrition, vitamins, exercise, chemicals that are detrimental to you, that's not practicing medicine. That's just making you aware of the different risks that you're taking out there with the food you're taking, the medications you're taking, the side effects, all of those factors. It's important for you to know so you make really good decisions. I'm going to give you an example. Sitting next to me today is one of my oldest friends. His name is Dr. Bruce Salzinger, and he's been practicing now in Atlanta, Georgia for, I'm thinking, over 30 years already, just about 30 years. And the thing that's exciting about that is we've been friends since we're 12 years old. And he's going to go into it a little more, but basically when I was doing my internship in New York City and he was living in New York, he had an injury to his lower back where the MDs were saying, this is what you need to do in order to get better. And I'm going to give it over to Bruce now, and this is another example where if you just go by what the doctors tell you and you don't do your own investigating and you don't check into things, you're going to find yourselves many times doing things that maybe you don't really need to do. Dr. Bruce?
Hi, once again, Dr. Bruce Salzinger, and it's a pleasure to be here, and hopefully I'm expecting all of you to keep an open mind, because fortunately I did. When, yes, as Dr. Silverman mentioned, God, it goes back almost 50 years ago now, I had a horrible ski accident. Actually, it wasn't horrible, meaning you're perceiving maybe I took a bad fall, but I didn't. I just twisted the wrong way. And just coincidentally, I was away for a weekend with someone whose father was a medical doctor. Anyway, we get back from being away, we go, and she couldn't recommend me to him because that wasn't his specialty, but he did recommend me. With my parents, okay, I went to see somebody because I was getting that sciatica actually down both legs. And that was their best opinion. Nothing wrong with that, of course. That was what they thought would help timely. And so I went. Unfortunately, after a few weeks of that, I wasn't getting any better. And now they were suggesting surgery. Maybe all of you have heard that before. We try medications. We might try physical therapy. Should that not work, it's an interventional approach. Fortunately, Dr. Mark, my friend, just coincidental to the time frame, he says, why don't you have me take a look? I could always have that surgery. So here I find my way to the clinic he was practicing in, an exam, diagnostics, meaning x-rays. We look at the film, and in hindsight, what got me was the diagnosis was the same. But the treatment approach to that diagnosis was different. And for those of you who might have been to a chiropractor, they point out on the film, do you see that bone there? It's putting pressure on that nerve. That hole right there should be bigger. And the treatment is not drugs, it's not interventional surgery, it's what's called an adjustment. And I'll never forget that first time he puts me on my side, maybe some of you have experienced this, and I'll never forget how that just went right into place. Now, was I immediately resolved? No, but it made perfect sense to me that if that's putting pressure on that, we got to take the pressure off. And then, of course, he gave me some homework, some what you would call physical therapy exercises, which I fortuitously listened and did as suggested. Plus, I followed the care plan probably several times a week. It's over 50 years ago now, but most likely it was that. And here I am today, not because specifically of that, but as time went on and I decided to change careers, I became a chiropractor because the results of getting chiropractic care was not just the relief of lower back pain, but when you take that pressure off of the nerve wherever in the body, and he is a health and wellness, call it full body provider. So if my low back was bothering me, he'd suggest, well, let's look at the other parts of your spine. And when that brain and spinal cord start to have better control and coordination of every aspect of your function, a long list of other symptoms that were just normal to me. Seasonal sinus conditions. In the winter, I would get upper respiratory things. All of a sudden, these things started to go away. And that's what good quality chiropractic care, best understood, can offer.
You know, it's an interesting point also, because here, this is a situation, as I've posted things in the past, about how back in the day, when I did my study with the HMO, if you had a herniated disc, you were getting hospitalized and you were getting surgery, and that was the medical approach to that. At that point, if you had that, they would inject the dye into your spine to see if it's herniated, and if it was herniated while you were still under anesthesia and they were doing the test, they would then do surgery on you. And like I've said earlier, there's a lot of people who got unnecessary surgery, didn't necessarily get great results. The side effects and the potential issues that come from spinal surgery, there's a lot of potential bad side effects that can come about. But I think the key with Bruce, when he was coming to me, was the thing he mentioned, which was that, because he was skeptical. Bruce is not somebody that jumps into things. Very conservative, analytical, before he makes any decisions. I know that about him, being friends with him for like over 60 years. So we know each other very well. And this is something that when I spoke to him and I go, Bruce, let's look at it this way. Let's say you come into me, let's say you get treatment with me, and you don't get well. It doesn't work. You always have that option of going back and getting the surgery. However, once you do the surgery, we can't undo the surgery and any of the negative effects that could take place. So to me, it was a much more conservative approach to try chiropractic. And besides doing that with Bruce, as I've talked about in other posts and other podcasts and other videos, I've had situations like that in my career over and over and over again, and I would have to tell you it's the impossible cases, supposedly impossible, those are the ones that have built my practice. I mean, it's that simple. When a gentleman from Eastern Airlines, one of the head people at Eastern Airlines came in and he told me he had been to all of these specialists, all of these doctors, and he was basically told that there was only one hope, which was surgery, and he didn't want to do the surgery. And he came in to see me and he told me, he goes, Doc, you know, I know that this is really a difficult case. I've been to a lot of doctors. They all tell me I need surgery, but I've heard all these crazy things about you. I figured I would come in and talk to you and see if I have a chance. So when I examined him, I go, Phil, you're right. This is a really tough case. I mean, your problems are really, really bad. But in all honesty, I knew right then and there after the initial exam that I was going to be able to help him. So I decided to play a little bit of gamesmanship, I guess, with him. And I told him how bad the condition was. And I told him I wanted to make him a deal. And he goes, well, what's the deal? I go, I'll tell you, I'll treat you for the next couple of months. And if for any reason you don't feel better, you don't have to pay me. He goes, wow. He goes, okay. And what if I do get better? I want to become the doctor for your airline. So he said, if you can do that with me, you got it. We took care of him. He got really, really great results. And before you knew it, I was doing all the pre-employment physicals. I was treating all the workers' comp injuries. And I was the #1 source of referrals for that airline, sometimes between 5 and 10 cases every week. So I did that with them. I did it with Hyatt. I did it with Hilton. I did it with Marriott. I did it with all of these major companies who were getting killed by medical bills and workers' comp cost and lost work time. They decided to try it out, and guess what? My statistics continued to hold through, and that over 90% of the people who came got really good results. So that's why we're sitting here today. We need to get you to understand. Now, we're not knocking medicine. There's a place for medicine, okay? It's just that medicine and medications are not the answer, okay? We can work very closely with medical people. I've had medical doctors in my practice almost my whole career and have never had problems working with MDs because we actually each have our place. And if we're working together for the best result for the patient, everybody wins. But what unfortunately happens is a lot of times the medical profession wants to control everything and make it sound like they're the only ones capable of that. And I can assure you that our education and the hours that we study the different courses, which include nutrition and diet and all of those other things that we're talking about, where in the medical profession, they really don't know too much about it. There are a lot of MDs now who are using that. There's a lot of pain management doctors. There's a lot of functional medicine doctors who use a natural approach, but they didn't learn that in medical school. They learned that on their own, afterwards, taking the appropriate courses. So what I want you to understand is that it doesn't matter how many doctors you've gone to, you should continue getting different opinions, because I'm telling you, in my practice, I would say a significant percentage of the patients who come to me have been to other doctors with no results. Bruce, I know that you've lectured even at the university. Why don't you talk a little bit about that? I think people need to hear that.
What you all need to understand is that the chiropractic profession, we call it, was discovered 129 years ago. 1895 is when they can trace back the first successful outcome from what was, in hindsight, termed an adjustment. Patient who had a loss of hearing found his way to a doctor's office, D.D. Palmer, in Davenport, Iowa. He couldn't hear. He found his way to the doctor's office with that complaint. Remember, we're back in the day, not with cars, but with cobblestone streets. He couldn't hear the noise on the streets, which could clearly be heard by someone who could hear well. Well, anyway, the doctor lays him down and just intuitively saw something that didn't make sense, and with what's called an adjustment, which is really just a light, gentle impulse on the vertebra of your spine, taking the pressure off of the nerve, the patient got up from the table and could hear the noise on the street. What's looked back on as a remarkable achievement. Why? Because the back and neck pain, which is typically marketed today, offices like Dr. Mark's and mine want you to understand how this works. It's not just pain relief, but it is reconnecting your brain, which is connected by your skull, and the skull has to protect that brain. Why? Because it controls and coordinates all function in your body. The brain is connected then to the rest of your body by the spinal cord, which is protected by the vertebra of your back. That cord goes down to your tailbone, and the nerves that come off of that cord go to every cell of your body. If there's pressure on that system, not necessarily pain, you in turn are going to have some, like a thermostat with a 100-watt bulb potential of that bulb, but it's turned down. And if it's not on the pain-sensitive portion, those of you that have breathing issues, those of you that have sleeping issues, those of you that are getting headaches, Those of you that are getting maybe heart issues, maybe you don't have enough energy. The list is almost everything. And if you're just going to take medication for that, again, we're not against it. Thank God we don't live in call it the 14th century, where none of this is available, but it's temporary relief with downside potential, which if you take those things on a regular basis and then combine them with several other different things, you're like a walking chemistry experiment. And we hear this all the time because eventually the patients come in very commonly. What happened? Well, I don't know. Well, what'd you do? Typical question. How can I help you? When did it happen? I don't know. What happened? I must have slept funny. Now, it's true. They might have slept funny, but typically, just like the straw that broke the camel's back, we hear something occurred and it's pressure over time, probably in a poor sleeping position, that yes, got that vertebra to go out of place. And more over time, people have come into our office. Why? Because from the 45 years ago when Mark first opened his office, this was very little understood. And for him to have reached, and then all of those thousands, tens of thousands, hundreds of thousands of people, not just in his office, but in other chiropractic offices, mine over 30 years. The number's a huge number of people now experiencing non-drug, non-surgical approach and coming to realize that our education is really not that much different from the interventional doctors, the surgeons, those that prescribe legend drugs, those you need the prescription for, to go to the pharmacy. No, we don't do that. But those first 2 years, pretty much, are where our educations are similar, the organic chemistry, physics, neuromuscular, skeletal anatomy, physiology. They then use interventional approaches, medications. We in turn then go into clinic and learn how to adjust the spine. And for those of us that have extra interest, the cranium, the jaw, shoulder, elbow, wrist, hip, knee, foot. You come to learn when you hear that expression, health and wellness, full body care, that just because your problem might be, call it the lower back, that might not necessarily be where your problem is. You're feeling it there, but you come to learn when you go to a doctor who look at you full spectrum, let's call it. The results, which I used to look at and be amazed by, all the young doctors that have come and have a similar experience over the many years in my office, I come to say to them, it's just another day in the office. You're going to see.
You know, Bruce, interestingly enough, what you brought up, that, chiropractic really formed after D.D. Palmer did that adjustment to Harvey Lillard, the janitor, who ended up becoming able to hear afterwards. But I can tell you that was like, how many years ago?
1895.
Okay, so we're looking at a long time ago. And I can tell you that I don't know any chiropractors that advertise on TV or anywhere else. If you're hard of hearing, come and see us. Because over the years, and I believe a lot of it has to be in order to be accepted into the medical community, the chiropractors started focusing more and more and more on certain types of problems like neck pain, back pain, things along those lines that are more easily accepted. But really the key is that when you have a problem in your neck, especially the upper neck, and it puts pressure on the nerves coming right from the brainstem, anywhere those nerves go, that's where you're going to have a problem. And you've got like the vagus nerve coming through that area, which is like what is one of the longest nerve in the body, and it affects everything, your heart, your intestines, your bowel, all of those areas. And so any pressure on those nerves, if not immediately, over a period of time, will cause malfunction in those areas, which leads to problems down the road, which of course, in general, people don't put one and one together and say, oh, this comes from this fall or this accident that I had 30 years ago. Okay, but wear and tear on your body when things are out of alignment lead to more problems down the road. For example, I always use the analogy, you could be driving the most expensive car with the most expensive tires, but if you run through a hole and the car goes out of alignment and you don't want to get it realigned, how long is it going to take for your tire on one side to wear out because the weight distribution from the car is not balanced? Well, the same thing happens with your hip joints. Okay, and what can happen is you can have your spine and your pelvis out of alignment. You can live with it, and over a period of time, because the weight distribution is off, it's going to cause degeneration and deterioration in the joint and may lead to needing a hip replacement or knee replacement. All of those things don't always just come from trauma. They can come from things not being in the right position over a long period of time. So it's really, really important. And I had one case, which is the only one that I had up until that point, where this lady was in an accident. I adjusted her neck. I had no idea about this history that she never shared it with me because she didn't feel it was connected. And it turned out that she called me one night after an adjustment and says to me, "Doc, there's a problem." I go, "What?" She goes, "I came home after that adjustment today and it's been bleeding in my ear." And that's when she wanted to tell me about the deafness that she had in one ear because she lived in London during World War II during the bombings. And as a result of that, there was so much damage to her nerve that she became deaf in that ear. And so she calls me and I told her, "Okay, let's do this. Let's put ice on it to see if we can stop the bleeding. And then I'll see you first thing tomorrow morning." So she came in the next morning and I go, "So how are you doing today?" She goes, "Doc, this is crazy." I go, "What?" She goes, "I told you that I was bleeding through my bad ear. I'm deaf in that ear for all these years and it started bleeding." And I go, "Okay, and did it stop after the ice?" And she goes, "Yeah." She goes, "But something really weird happened." And I go, "What?" She says, "I always go to sleep with the bad ear up because since I'm deaf in that ear, I don't hear the traffic, I don't hear noise, I don't hear anything, and it's easier for me to sleep." After the bleeding in that ear stopped, I noticed when I went to bed with the bad ear up that I was hearing everything. I kind of like freaked out, like how could this be, you know? And it turned out that the hearing came back in that ear after the adjustment. We sent her to many different specialists to try and see what their explanation was as to why the hearing came back, and they said there could have been a blockage of a blood vessel or something along those lines. But nobody, the medical professionals that I sent her to, couldn't figure it out. All they knew was that she was hearing. And I've had cases like that, not only with hearing, but with people with visual problems, which without getting into it, that same lady referred me her niece, who is blind in one eye from an infection she had in when she was 1 year old. And she started coming for treatment, and one day, on the way home, she covered her good eye, and with her bad eye, she started reading one of our forms to her aunt who was bringing her for the treatment. So then I was dealing with another issue because they wanted to tell the world about their results, and I was questioning, should I put her on TV and should I put her on radio? I said I could just see all the chiropractors out there saying, Silverman's claiming he cures the deaf and he cures the blind. And I didn't know I wanted to get into a political thing like that. But the point is, by releasing pressure on the nerves, you would be amazed. I have gotten incredible results with women, for example, who have problems when they menstruate. They had a tremendous amount of problem. There's techniques for the uterus. There's techniques for the ovaries. There's problems with the stomach. I mean, there's so many things that can really get great results with chiropractic, but the problem is twofold. Number one, the patients don't understand that they can get those results, and the chiropractors themselves don't necessarily educate the public as to all these different things that we can do. So it's kind of interesting, it's exciting, and as things are moving in that direction now, I think people are definitely looking for more holistic answers to their problems.
So ladies and gentlemen, I know you've been listening closely. Listen a little more closely. Because if you're wondering from 1895 why more people don't or are unaware, here we are in 2024. Well, fortuitously, that initial adjustment D.D. Palmer's children, 2 or 3, I'm not sure, 2 for sure, of his children decided to learn. And they were known as the developers of chiropractic. They analyzed cadavers. They analyzed whoever would give them the opportunity. Because what happened with that first healing of the hearing, that person was telling everybody. And the father's practice was getting ever busier. Anyway, they came to realize that they needed a college to teach others. And that then became the first college in Davenport, Iowa, Palmer College of Chiropractic. Mm-hmm. Incredibly, in those days, the intuitiveness of B.J. Palmer, the son, he had to start advertising. The radio station back then would broadcast East and West, was done by Ronald Reagan. Ronald Reagan was the broadcaster, the eventual president of the United States. They were advertising on his radio station. He was open-minded to it. But what the chiropractic profession started to realize is that the successes we were getting were now stepping on the toes of the medical profession. Those that were attracted to Palmer College of Chiropractic because of a favorable experience they had in whatever communities they were in, eventually became Life University, eventually became Cleveland Clinic, eventually became Parker College of Chiropractic, to where now thousands of chiropractors are now treating tens, if not hundreds of thousands of patients on a regular basis. Now, Mark mentioned an incident that is remarkable for him. I had what I thought was a very unique incident. A woman comes to me for a car accident. And in the time I helped her, and then in a busy practice, you get them better, and if they're not coming back for whatever reason, you forgot you even treated them. Anyway, we educated her, she got better. I go to a restaurant to pick up a sandwich. I had to run back to my office. So I went to a place where there were lines to pay. This place was so busy. Anyway, one of the cashiers was that woman. And she goes, "Doc, hi, how are you?" And I recognized her. "Hey, hi, how are you?" And the cashier next to her says, "Well, who's he?" "He's my chiropractor." "What does a chiropractor do?" she asked. She says to her, "He got me pregnant." Right. And I'm like, okay, but all the people in line to pay as well were now listening to her. Well, he explained to me that, right over here goes here, and my husband and I were having a problem. And, okay, well, now I have this 1-year-old baby boy, and everyone's like this. And, I got my sandwich, I want to pay. And sometimes you just say to yourself, this was the reason I got fortunate. Because just to throw in another one I could be kind of clear with. A woman, in fact, from Colombia, South America, was a Latin ballroom dancing instructor. And one day she's standing on the stage teaching her class, and she's holding on the curtain, and the curtain gave way. She falls into the orchestra pit. She shows up at my office in a wheelchair. Her husband's pushing a wheelchair. She had been everywhere. Of course, I did what I needed to do, the exam, the diagnostics, fortunately I was able to get. Husband says, "Can you help?" I said, "I think I can." Anyway, a few treatments later, it didn't happen overnight, but a few treatments later, she comes in, wheels her in. She goes, "Doc, I got to show you something." She ends up going like this, gets herself out of the wheelchair, and walked the entire length of my clinic. She says, "I got to show you." I'm like this. If I was put on the planet for this reason, to help this woman, it was worth it. I felt so proud of what she and I achieved together, really. And chiropractic gives you the tools, but you've got to listen to the homework, let's call it.
Expanding on what Dr. Bruce spoke about with the patient who got pregnant, again, those are one of those areas that any chiropractor and any physician knows that the nerves from the lower back, from the lumbar plexus, they go to the ovaries, they go to the uterus, there's a connection. But again, You've never heard, I doubt you've ever heard a chiropractor advertising, are you having menstrual cramps? Call me. Because, not the usual type of a case that you would expect a chiropractor to take care of. Now, I had a lady, I remember a story, where she had a really bad low back problem with some radiating pain into her groin. And she was coming for treatment, and she started feeling better and everything. And then one day, similar to Bruce's story, she came in and she said, I never told you this because I didn't think you had anything to do with it, but I'm wondering because I started coming in for adjustments a couple of months ago, and my husband and I have been trying to get pregnant for about 7 years and have never been able to. We've gone to all these specialists and everything, and they told me I had a problem with the uterus and it's tipped and this and that. And all I know is that I'm pregnant. I got pregnant. Is there a connection between what you do and it? And then I explained to her how it all worked. And at that point, I became more aware that chiropractic could be good for that. And over a period of time, when women would come into me with those low back problems, that would be one of the questions I would ask about if they've had any children, if they have any issues down there and things like that. And you would be amazed how many of those people who are having trouble getting pregnant were able to get pregnant after getting everything aligned and getting the chiropractic adjustments that way. Matter of fact, we used to joke that I was going to put a commercial and say, if you're having trouble getting pregnant, go see Dr. Silverman. He'll get you pregnant without taking his pants off, by doing just adjustments. So, we never did it. It was a little too risque, and I understand that, but it was funny because, again, what I have found over the years is most people come in for back and neck related problems, but a lot of times they have other issues that they don't necessarily connect with what we do. And then over time, guess what? They get good results.
The public is in an extremely unique position today in that the change of administration, call it in Washington, has now changing the Department of Health and Human Services to where Robert F. Kennedy Jr. is going to be, so to speak, shining a spotlight on issues that are health related for all of us. The water, the food, the drugs, the vaccinations. A short list, which I'm sure will get longer. But for the people that are coming into us that are being affected by that are on a medication or 2 or 3, and they're just being managed. They're being healthcare managed. I've got to tell you, you've got to keep an open mind to changing what is now becoming the health and wellness revolution. You've got to better take care of yourself or accept the consequences of poor choices. You can come to our office and get the greatest care, as we're saying, putting this back in touch with that. But would you put the wrong gasoline in your car? Would you put poor fertilizer to take care of your plants and not clean water and fresh air and sunshine? We all respond similarly. But you must take responsibility for that behavior. Now, if you do, because this has been my approach for 30 plus years in my office, I have a lot of people who, whether they have insurance or not, come on a regular basis because, in their words, I just feel better if I do. And in between time, they're doing what their mother told them to do, I kid them. Sit up straight, eat your fruit and vegetables, go outside and play, positive mental attitude. It's not more complicated than that. And you find a chiropractor you trust who treats you responsibly and gets the job done.
That's words of wisdom. I'm telling you that, we are more apt to take care of our car, changing the oil or changing the spark plugs or doing whatever you need to do to maintain your car. Why? Because you don't want things to wear out. It's more expensive. You want your car to last as long as possible. So you got to keep it in as good shape as possible. So in general, people take better care of their cars, yet they don't seem to have time to go to the gym or to eat right or to do the things that you could be doing, even though there's a tremendous amount of documentation out there now, for example, that shows that working out and exercising a few times a week can add 30% to your lifespan. And there's all these other studies that are coming out. And don't pay attention to these people who all they do is say, oh, he's, fear-mongering, or he's just, he's not a doctor, or this or that or the other thing. Trust me, MDs have a lot of knowledge, but in a specific area. Chiropractors and other specialists should be able to work together for the benefit of the patient. It says in the Hippocratic Oath to not harm your patients, okay? Yet they know that potentially there's a lot of harm in some of the medications that the patients are taking. And I understand that certain times you have to say, this is the potential problems that you can get from taking this medication, and make a decision whether or not the positive outcome from that medication is worth the risk for the negative. But you should know about it, and then you can make a logical decision, and you can also look into more natural approaches to see if there's other options. Because you read all the time and you hear all the time about people who get well from what you might consider to be unconventional types of treatment.
Correct. Correct. Many of you, all of you, I'm sure, if you watch any television, and you see these commercials with them dancing in the hot tub and they're doing the mambo on the beach, and then there's 40 seconds or longer. Well, if you blink, if you swallow, if you like to say hello to your friend, these are contraindications which could lead to serious conditions. Of course, I'm kidding in those things, but the contraindications for taking these things are a long list of things that they'd prefer you didn't do. But thank God we live in a country where you must at least do that, because that's protection of at least you're being informed. You go to get a prescription, you go to the pharmacy, they're glad to fill it. In the boxes are paper, who reads them? But those things you need to understand, certainly taken irresponsibly, are dangerous. Chiropractic's not claiming to be an answer for all things under all time. But if you understand our approach, which is non-drug, non-surgical, that's the reason we don't have the medical doctor's expertise. We're not taught that. And the reason they're not referring you to us is because they don't get any chiropractic education in their education. They're taught what they're telling you, and they believe that approach. And it's not that it doesn't work, but you need to be aware of the potential downside to managing care and never really getting resolution. Fortuitously, they're there. Please don't get me wrong. My family doesn't just rely on chiropractic care, nor have I. But chiropractic care is my first choice when things start to either I'm not maintaining as healthy as I'd like to be, or I'd like the opinion on I've got this issue now, what do you got? Mm-hmm. And I'm glad I've taken that approach now over 50 years.
What can be done with chiropractic is amazing, but you have to be willing to take the first step. If you don't take the first step, then nothing happens, nothing changes. And for some of you who have been very medically oriented, it's very hard for you, I understand, to hear some of these things because you feel like it kind of goes against what you've been taught. But understand that there is a place for everyone. And like I said, in my practices over the years, I've worked with general medicine doctors, with cardiologists, with pain management, with orthopedic surgeons, with neuros. I've worked with every single type of physician. Never had a problem because of the fact that they were not threatened by me. They looked at me as being part of the same team, not like I was looking to take away their business. And I got to be honest, I mean, a lot of these people who make these comments that are saying that he's not an MD. I know I never wanted to be an MD. I became a chiropractor because I wanted to be a chiropractor, okay? And chiropractic is different than medicine. We do not depend on medicine as a way to get people well. It's really that simple. On the other hand, we're not telling you that medicine doesn't have its place. And there are times that it's absolutely necessary and it definitely helps. But it's not for everything. There's a lot of approaches. And if you're trying to do something where you're not just getting rid of the symptoms, you're not just trying to get rid of the pain, you're trying to get healthier. You're trying to get your tissue, your muscles, your ligaments, your tendons functioning better and stronger. That's something that the medical profession just doesn't offer.
Contact us today. We'll put on the screen a contact to direct message us, email, the websites. We want to continue doing this on a regular basis. And of course, if there are other topics you'd want us to get into, be it nutrition, be it specific exercise, that's where we want to take this. So if we see there's an interest, let us know, and let's see if we can help more people.
You know, something that's also interesting, Doc, and that is that, you know, like medicine, the medical doctors use different medications. Now, there's not only one medication in general for different types of problems. There's anti-inflammatories, there's muscle relaxers, there's more than one type. They all work a little bit differently. But one of the things that I've heard in my practice is I went to a chiropractor and it didn't help me. It didn't work. Now, let me also make you aware that there's many different techniques in chiropractic, okay? Just like MDs use different medications, chiropractors use different techniques. And not every technique is going to be just as effective on certain types of cases, or maybe the doctor may not be as tuned in to that type of a problem, and maybe his technique is not the right one for it. So what I'm saying is that if you went to a doctor, a medical doctor, and you didn't necessarily get the results you want, you wouldn't say, I tried medicine and it doesn't work for me. That would be a ridiculous statement. The same thing holds true with chiropractic. If you went to a chiropractor and he didn't get you the results and you didn't get the results with him that you wanted, try another chiropractor, just like you would try a different medical doctor if you didn't get the results with him. Many people go to 2 or 3 different MDs in order to make their decision who they want to use for their treatment. The same thing should be for chiropractic, because all of us use different techniques.
I agree with that statement wholeheartedly. If we're frustrated, we can't. I'll have you talk to the 1 or 2 or the 3 other docs in my office or in the neighborhood where it's convenient for you to listen to what their approach might be. And God willing, they can help you. Who's next, we say.